Welcome back to Living Out Loud. I'm Susan Karp, the Executive Director of the Arlington Council on Aging, and this is our second session that we are filming today, so I didn't change my clothes. Anyway, I want to welcome today. So every semester we have nurses that are visiting us to complete their community health rotation from different colleges and universities. So I actually invited Mike, who is from Northeastern, doing such a thing. He's been with us all semester and just about ready to wrap up his time here.
Yes.
Mike, we really appreciate that you chose Arlington Council on Aging and all that you've been able to do in the community. I know that your program that you are wanting to share, information that you're wanting to share today, is on pain management, and specifically the non-pharmacological. Okay, I didn't get that right. I practiced
Yes.
the non-pharmacy approach.
Yes.
So Mike, I'd like to welcome you. I'd like to turn it over to you, and if you could just talk to me about what is pain, what's pain management, what are some things that our seniors can think about and discuss with their medical caregivers.
All right. Well, and thank you very much for having me, especially for all the information that I've learned a lot throughout this whole semester with the Council on Aging. So pain, it can be defined many ways. The International Association of Pain, or the study of pain, defines it as an unpleasant sensory and emotional experience associated with the actual or potential for tissue damage, and describes in terms of such damage. So not necessarily, you don't actually have to have physical damage to your body in order to feel pain. It can be just you're thinking about the pain or you're anticipating the pain.
Okay.
So anxiety in terms of anxiety can increase pain. Mm-hmm. It just makes it can increase all types of pain, or it can even make pain that's not even there.
Right, and you can even imagine if you're getting an injection.
Yes.
Or your blood drawn. You're like, oh, I know that's going to hurt.
Yes.
And you build up to it. Now that's something very minor. I mean,
And it's the same, and that also goes with surgeries. It even goes as far as if you have more anxiety before you go into a surgery, then it could actually make the time that you're actually in the hospital more lengthy stay.
Okay.
Because if you're more relaxed and you don't have as much anxiety, it increases the
pain centers, which then cause...
Yes, yeah, well, yeah, it decreases the pain centers, right. Or it'll increase your body's ability to heal on its own.
A little bit of mind over matter, or mind-body
exactly.
connection, okay.
Yes. The way pain perception works, it works on nociceptors, I think I'm saying that right. Latin for the word hurt, so that's where they get their name from, because they bring pain. So the way pain works, you touch a stimulus, or a stimulus gets acted upon you, like you cut your finger.
Yeah.
It's makes these neurons fire, and they go through. These nociceptors fire, and they send the signals to your brain. Then your brain interprets it as pain.
Okay. That's an easy concept.
Yes. There's two types of nociceptors. There's A delta nerve fibers, which are really fast. Mm-hmm. They're more of the sharp pain that you feel, like immediately after cut, you feel that sharp pain.
Yeah.
And there's slow fibers called C fibers. They're the dull ache after the first initial sharp pain.
Okay.
These are more of survival instincts. The whole function of pain is to survive. You feel something, you don't want to touch it anymore because it's going to hurt you.
Right.
So it's a survival instinct built in. Most animals, I think all animals have it.
Now, who would have thought it was a survival technique to be frozen in space after you just maybe fell and broke your hip or broke your arm? Yeah. I can't move. That's a defense mechanism to the pain.
Yes. It tells you to either not move something or to move something, get away from something, so that the rest of the body can survive. It's weird how your perception of things can.
Right.
As soon as you change your perception, the perception on pain. It's it goes from this just hurts me. Why do I have this? Why do I even have this? To it's for a reason, so that I can.
It hurts, so therefore
learn.
Stop.
Yes.
Or it hurts, therefore I can't move. So that's a normal reaction.
Yes. There's a couple different types of different theories on how to deal with pain. One of the more recent ones is called the gate theory.
The gate theory?
Gate theory, yes.
Okay, so what's that all about?
So the way the gate theory is presented is that you'll have your stimulus that acts upon the original nociceptor, the original nerve, as it travels up and goes to your spinal column before it gets to your brain. The way that the gate theory works is that there is basically a gate. Basically, your A fibers and your C fibers meet, and either one or two can, the gate's either open to one or open to another.
Okay.
Now, so you have your A and your C fibers, and the gate is pretty much across all the nerves. So you have your A fibers, your C fibers, and you also have your sensory nerves, that, how you feel touch, or how you feel cold, or how you feel heat.
Yeah.
You'll have those all there as well. So gate theory is if you cut yourself, the pain goes up through your spinal column. The gate goes open to that side, lets that stimulus go through up your spinal column to your brain. Your brain interprets it as pain. Now, what they say you can do is, if you've ever cut your finger and then you rubbed it, or you shook it and then you rubbed it,
Yep.
you don't feel the pain as much.
Okay.
Because you have that fast stimulus from the A fibers go up, and you feel the immediate sharp pain. After that, then you start having the slower fibers come through.
Okay.
Because the sharp pain is the original defense. And as you rub it, the gate's open towards the slow fibers, and as you rub it, you introduce a new stimulus,
Yep.
and it closes that gate, so all you feel is the rubbing and not the actual pain.
So basically, it's the distractor factor.
Yes, yes.
All right. So is that a part of the pain management?
Yes, yes. Oh. Some of the pain management techniques work a lot on distraction, because your mind, like as I stated earlier with the anxiety, your mind can control how much pain you feel,
Yeah.
or how your brain actually interprets the pain. Now, there's a lot more in-depth studies on a lot of more like actual psychological therapies for how to actually change the way your mind interprets pain altogether.
All right.
But those are fairly new, and they're ongoing.
Okay. So let's see, what else do you have here?
Okay, so the quick and easy pain management techniques are, of course, heat and ice. Now, heat
I know them well.
Yes. If you do any type of working out, or if you've ever done any working out, heat and ice are absolutely amazing.
Now, mind you, the segment before you, we had Lillian Christmas and Greg Tucher from Mass Senior Games. So
Okay.
we're talking about older adults being very active. So if they were on set with us, I'm sure that they could also echo in on the
Yes.
heat and the ice.
Yes,
I
definitely.
tend to favor ice, by the way, but I'm going to let you continue on.
Ice is really good for decreasing swelling. So you initially get some kind of trauma, or I say trauma, but that could be anything that's abnormal.
Trauma could be a puncture of the skin.
Could be a puncture on the skin. Could be running. You're putting trauma on your knees. So with any types of trauma, you're going to have inflammation as your body fights to pretty much go back to norms. So as you have the inflammation, the ice will actually make the swelling go down, make that inflammation go down, so it's not as prevalent. It decreases the constricts your blood vessels in that area.
Yep.
And decreases the swelling, and also can work on taking away pain, like the actual sensation of pain, with the gate theory, closing the gate.
Yeah.
Now with heat is good for a variety of reasons as well. It opens up the
Blood vessels?
Well, it opens up the blood vessels, dilates them.
Yeah.
Gets more of your cells in there so they can do their job. Because your body has, if with every trauma, your body has to fix itself. Whether it's, putting platelets in, or whether it's fighting off an infection, or whether it's just repairing whatever's broken.
Yeah.
Your body needs to have, your blood vessels need to be dilated in order for the blood to get there. So you can do an alternating will work, but it ultimately depends on what the person feels. Nothing like pain management is never, it's not specific to one person, or it's not generalized. It's always specific to one person. One thing may work better for you, and it might not work as good for somebody else. It all depends on how they deal with things.
And there is no perfect answer for pain management. So that's the other piece that I'm sure somewhere in there you're going to say that these are all a series of things to be thinking about and trying.
Yes, yes.
So besides the pain and the heat, to try to do the gate thing.
Yes, and it does also, it works on with the sensory to do the gate control the gait, to control what sensations go to your brain.
Right.
There's also the fact that the heat. Heat also loosens muscle. So if it's a muscle type of pain,
Yep.
the heat, just like taking a hot shower or sitting in a sauna, the heat will actually like loosen you up. That also can help with strained muscles, and it goes in towards doing massage.
And arthritis.
Yes, yes, yes. And when you're doing heat, or not when you're doing heat, if you try heat and it works a little bit, but it's not working the way you want it, and you want to go towards ice, or if you just see swelling,
Yeah.
you start seeing the puffiness, and you want to try ice, it's always good to never put ice directly on your skin for any length of time.
Right.
Always put it into some sort of plastic bag, and then cover it with like a
thin.
any towel.
Yeah.
Will work. You don't have to triple it up or anything like that. Just
Right.
one layer, 1 or 2 layers
Yeah.
will be fine on a normal towel, and use that and only place on your skin for about 15 to 20 minutes. Especially for those of us that are a little bit older, sometimes the sensation to heat and cold is a little bit
Yeah.
duller.
Yeah.
And so, but your skin's still sensitive to the same thing.
Right.
So it might not feel as cold on your skin, but it's still cold enough to do damage to your skin by keeping it straight on, keeping it flat on there. Those are the most important things to remember. Is pretty much heat and ice are both the same when it comes to the duration, 15 to 30 minutes on, and then about an hour off, and then put it back on.
Oh, okay.
So try not to keep it on for like a full hour. There's really no need to. And the only thing it does is increase the chance of damage. Another great thing that most people don't realize is laughter. If you laugh, you release endorphins, and it helps you let go of stress. If you're really angry and somebody says something funny and you laugh, it immediately takes it really does decrease the anger and just
So
lets it go right out.
when they say laughter is the best medicine, there is some truth to
Yes,
that.
yes it is.
Wow.
And I 100% believe that.
Oh, that's great though. That just reinforces. Good, good.
There's also, along with when you're going down through pain management techniques and you're trying to distinguish which ones to try to use, distraction is also one, and also is breathing techniques. Now, breathing techniques are also, most people use them for
Meditation
and like with certain respiratory disorders, they'll teach you how to breathe through, like pursed lip breathing, breathe in through your nose, breathe out through your mouth, like,
Okay.
to blow out a lot of air, to
Yeah.
get most of the air out, so that you'll be able to intake a lot of air. And most people are taught that especially when they're like going through surgeries, or if you have like COPD, you would most likely be taught how to do that. Same thing with like pregnancy and Lamaze, they'll use breathing.
Yeah.
A good thing an interesting way to look at it is if it's good for somebody going through birth to decrease pain, there's a good chance it's going to work.
Sure.
And so concentrating on your breathing, it kind of works on the distraction. It gives you something that you can focus on, and you'll have your mind focus on that and less on the actual pain that's coming through.
True, and actually at the Council on Aging, we do have meditation classes that we run about 2 to 3 times a year. And even though you're talking about pain management, the breathing techniques that you learn through the meditation, that also flows into basically every area of your life.
Yes, and it can really decrease anxiety, which can, as we've talked about, can actually increase pain.
So what you're really saying is that everything really is interconnected.
Yes. Yes.
So you've got different types
Yeah,
of
I got
breathing
different types of breathing. I got
techniques
the pursed lip breathing and the abdominal breathing. The pursed lip breathing, I think, is a little bit. I personally think that's a little bit better.
Yeah.
Because you are more focused on. There's a couple more steps, and you're blowing out through your lips, but you have to keep your lips together so you can focus more on the sensation of the air going past your lips, or the sensation of the air coming in through your nose. With the abdominal breathing, it's really good for. It's good for other areas. It does have some help. Like some people might prefer that, the abdominal breathing, which is a good way to do it. It's kind of hard to initially get started.
Yeah.
But it's good to start. If you're lying down, to start doing it that way.
I think we could have a whole segment just on how to breathe.
Yes. It's all about being able to have your diaphragm go down a little bit more, and you're making your abdomen will actually go in and out, which
Yeah.
is why they call it abdominal breathing, and it helps increase the capacity of your lungs. It mostly I think that that's really good for actually like when you're working out, but it does have some prevalence to pain management because if you find yourself doing that and you can concentrate on that, then I mean if it works,
Right.
like
It
I said
helps you.
before.
It helps you to focus on something other than the thing that's stimulating the pain.
Yes, yes. Another really interesting interesting thing to try to do with how everything's connected in the power of the mind is guided imagery, which goes on with which kind of leads into the meditation, putting yourself in a different place or thinking of a specific point in time that you
Yeah.
remember clearly. And it is really amazing how well that will just decrease anxiety. You'll focus on that. I've even seen people like actually smell and really feel like people. I remember doing it with one woman, and she said that she could feel the wind coming off the ocean because her mind was on the
Oh,
beach.
I really like
And
that.
it was
I
it
do.
was really good, and it helped her a lot. They do a lot of guided imagery when it comes to infections and disease processes as well. Guided imagery could be used for, pain relieving, getting your mind off the pain with distraction, or there's cancer patients will use that meditation to. It's kind of like they'll meditate and they'll picture the cancer cells
cell?
in their body and they'll picture their cells fighting the cancer cells. I've
Yeah.
seen I've heard of patients using like the simulation of like tanks fighting an enemy of some sort.
Oh, all right.
And they'll
Yeah.
use that. And there's studies that say that it does help. Of course, there's never 100% definitive anything, but if it works and it helps for some, you have to try. It's worth a try.
Gotta try it.
Now, if you're going to do the guided imagery, there's a couple different, like I said, there's the cellular imagery for helping fighting infections. There's metaphoric, which works on symbols, not really like a concrete thing that you're focusing on, but just focusing on like an idea, like the flowers opening up, kind of like. Yeah, flowers budding and opening is releasing of tension, or if you have like a lot of swelling or a lot of pressure somewhere, you can use guided imagery to think of like a flower opening up, and that's releasing the tension, releasing the fluid, and it's supposed to be able to help as well, especially with the pain. When you're doing the guided imagery, it's best to choose a time and place where you're least likely to be disturbed.
Yeah.
Be comfortable. As comfortable as you can be,
yeah.
depending on what injury or what pain you have. Before beginning, tell others that you want at least like 15-20 minutes to just focus on this. It's not ideal to drive and do guided imagery
No,
for
and
obvious
I'm
reasons.
on the road a lot, and I think most of the people that are in front of me or back of me are doing guided imagery. Sorry.
Yes. So it's good to comfortable temperature, comfortable location.
Yeah.
Try not to have anyone disturb you. Sometimes you can fall asleep. You can use guided imagery to fall asleep.
Yeah.
If you're having trouble falling asleep because of pain, you can put yourself in a relaxed state, focus on another place, another time, and just use that to. And you can use multiple different, You can use different, different classes of the imagery to start at one thing to relax, one thing to get your mind off the pain, and then slowly move to something that will actually relax you, and then you actually go to sleep.
And you know what I'm thinking though, Mike? This is a lot of really great information that sometimes a program such as this doesn't always give us time to do.
Yes.
So what I'd like you to do, because I'm concerned that I want to make sure that our audience hears the things that you're wanting to say, but are there some other highlighted items that we can go over before we have to close today?
Yes. So
We've gone over the imagery,
Yes.
taking our mind to a different spot, doing some breathing techniques. but are there some physical kinds of things? I'm seeing a paper
Yes.
here.
Now, with the same thing how people do yoga, and it helps it stretches their muscles out,
Yeah.
and helps keep the body in alignment. There is benefits to that as well. Now, if you can't, if for some reason you can't go onto the floor, onto a mat with a yoga mat and a yoga
Right.
instructor, and you're stuck, depending on your situation and where you live, you can do things like static stretching in a chair.
Well, you know
Yes.
what, and we have a chair yoga class on
Yes.
Thursday afternoons from 2 to 3. And that is specifically designed for the individual to be sitting in the chair. It's the gentle stretching, so it increases the flexibility because and I'm thinking of arthritis, because arthritis as a chronic disease and certainly very, very painful. It can take someone a long time to get going during the day. So by
Yes.
having it in the afternoon, by the gentle, I'm doing this because this is one of the stretching exercises. It's that, and then to use the visualization that by moving your hands, you're increasing the flow of
Yes.
blood, cells are moving around, and there's some positive response. So imagery happens all the time,
Yes.
and I can see how it's a beneficial thing. So as we move on in terms of stretching, because the Council on Aging has a lot of classes, both from meditation as well as the stretching to help with pain. People are thinking they're doing it for good health, to stay in shape, but to realize that everything that you do to stay in shape, to do what your doctor says with a good diet and all of that, also can come into play for pain management. We just don't label it as pain management.
That is true, yes.
So that's why this is really good. So what else do you have there?
There's different types of stretching depending on your age and what you want to accomplish. Now with yoga, you get into a position, you hold that for a certain amount of time, and then you let that go, and you move into another position. What I have found that actually helps out a lot, especially with people that can't do a more dynamic stretching or like a really deep stretch, is that when you're stretching, you only want to stretch and go into that stretch as far as you feel comfortable, or as far as to the point where it starts to be uncomfortable. Like if it's really starting to be uncomfortable and hurt, you back off a little bit and loosen it up a little bit. Don't want to go that far. Now, what I like to do is it's kind of like it's a two-step static stretch. So you'll stretch. You're doing every stretch twice. So the first one, let's say you're putting your arm across your chest. You go as far as you can until it starts to feel uncomfortable, and you just hold it there for 10 to 20 seconds.
Yeah.
And you'll let it go, and you'll go back, and you'll wait another 3 to 5 seconds, and then you'll go do it again, and you'll notice that you can go a little bit farther. Don't push it a little bit farther. If you can't go a little bit farther, that's fine.
Yeah.
But as you continue to do it, you'll notice that the second time you'll actually be able to go a little bit farther. And it helps to get a little bit deeper of a stretch.
Well, that's a great point.
Especially good to use if you are in a warm room or in a hot, or doing a warm shower if you can. Or like I know some showers have chairs in them. If you could do do the stretching in the shower in the chair, your body will be warm, your muscles will be loose, and you'll be able to get a really good stretch that way. Massage and aromatherapy kind of do similar with the distraction.
I love my massages.
Massage is really good for muscle type pain, and it's also good to just decrease tension overall within your body. And the same thing with aromatherapy. Aromatherapy is really good with the guided imagery because your sense of smell is closely linked to your memory.
Well, you know what? I'm always going to opt for the therapist's elbow in that knot in my back over something that smells nice. But thanks for bringing that one up.
Yes, different aromas are known to help out a little bit with to help out and assist with getting to a relaxed state.
You know what? I actually used to use lilac to put on my pillow at night so that if I woke up, that as I would go back to sleep, I would smell that, and that would be a distractor.
Yes.
Now I'm telling you secrets, but
and
I don't use lilac anymore.
I've seen pillows with lavender placed inside too as well.
Yeah.
In order to get their mind off of whatever that is that they're thinking about and have them focus on the smell.
So when the
focus
local
on sleeping.
stores start selling lavender, we'll know you've been watching. All right. So where else are we on this?
One of the more important things that I like to use. This can be used with for pain management, and I think it's mostly closely related to, or has more importance in if you wake up in the middle of the night and you're in pain, you can't sleep.
Right, right.
So you can also do this in the morning time before you get out of bed, which is kind of like a stretching exercise. It's called a progressive muscle relaxation. It's really good for getting to sleep. It's also really good I use it like a modified version to when I wake up, because if how you're doing yoga and you're moving your cells,
Yeah.
everything's loosening up. How you do the yoga in the afternoon.
Yep.
That you could do this in the morning to help you help you start the day. It's similar to yoga. It teaches you how to relax your muscles through a two-step process. First you tense a particular muscle group in your body, and then you release the tension. So It's very, very simple. The only time it gets a little difficult is because you only want to do one muscle group at a time. So if you want to do your hand, you just want to do your hand. You don't want to do your bicep, your forearm, or you don't want to do as much as your forearm. You kind of have to, but you don't want to do as much as your forearm. But you definitely don't want to do your bicep or your tricep or anything else.
That one would take me a little bit to do.
And it really helps you once you do the original progressive muscle relaxation, which is the tensing of the muscle as much as you can. Take a slow, deep breath in, squeeze, hold it for 5 seconds, and then deep breath out. But then when you release, you don't have to release it gently. You can just release.
All right.
It doesn't have to be a gentle release. You want it to just immediately relax as quick as you can. You don't necessarily have to move it. Now, you like I said before, you want to pay attention not to hit other muscles, not to activate other muscles while you don't, because you want to do one muscle at a time.
I think we need a class on that.
Yeah. Now, when I do this, I usually start with my feet and work my way up.
Yeah.
And I usually do it in bed when I'm sleeping. So I'll start with my feet. Because if I'm having trouble going to sleep or if my mind's racing, I'll use this. I'll clear everything else out of my mind and focus on the body.
Oh.
Focus on the tension and then release. Then do your calves. Then do your thighs. And a lot of times, by the time you get close to your abdomen or your chest or even your hands, you're usually forgot about. You're not even worried about what was racing through your mind, and you're focusing on the sensation of relaxation in your muscles, and it can help you relax and go into sleep. Now, in the morning time, you can do a quick. Once you're comfortable doing the two-step process, you can switch to a release-only process. By doing when you can focus on just the relaxing of your muscles. So if you're feeling tense anywhere, if you just want to do something quick, you could just start with each muscle group, and then you'll just do the second part, just the relaxing phase. You'll still do your deep breath in. You just don't need to tighten it, and you'll just focus on the sensation that you would feel when you're relaxed, and you can do that, and that can help you relax and actually it's just quicker.
This is, Mike, this has been great, and unfortunately, we're running out of time. So I just really, want to say thank you. It gives us something to think about pain management in a little bit different way. If there was a cure for all pain, someone would be an ultra-billionaire living on some island. So these are techniques to put into your toolbox, so to speak, to try to work with it. You can talk to your doctor. You can see about different classes. As I said, we host the stress management classes, which is the breathing. And maybe, we can incorporate some techniques, but it's given me something to think about. I want to say thank you very much for joining us this semester and Living Out Loud. It's Susan Karp until we see you again. Thanks for joining us.